The adductor brevis attaches from the inferior pubic ramus and the proximal portion of the linea aspera. And because it crosses both the pelvis and the femur, we know it's going to have actions in both of those areas. At the pelvis, its main action is going to be anteversion of the pelvis or anteriorly tilting the pelvis. And then it's also going to Hey everyone, Steven here with TV Fork, and this week's YouTube shorts are dedicated to the adductor brevis muscle. As with all of the adductor muscles, one of the actions of the adductor brevis is going to be anteversion of the pelvis, which is going to make it a very important muscle when it comes to managing things like low back pain. If you recall from earlier videos, one of the reasons why most people develop low back pain is going to be due to dysfunction in the lumbopelvifemoral complex, basically where the lumbar spine meets the pelvis meets the femur. And one of the most common postural faults in the lumbopelvifemoral complex is going to be excessive anteversion of the pelvis or an anterior pelvic tilt. For men, 4 to 7 is going to be acceptable, and for women, 7 to 11 degrees is going to be acceptable. When it goes beyond that, that's going to be considered dysfunctional. And with regard to the adductor brevis, when the adductor brevis gets really, really tight, what's going to happen is it's going to pull the pelvis into more anteversion and exacerbate symptoms of an anterior pelvic tilt. So what you would want to do to address that is some myofascial stretching exercises for the adductor brevis. For the adductor brevis, there are only 2 bones that we need to be covering, and that is going to be the pelvis and the femur. With regard to the pelvis, if we go medially and most inferiorly, right in the middle is going to be the pubic symphysis, and then just lateral to that we have the pubic bone, and this is the anterior pubic body. Then inferior to that, you can't really see it, but right over here is the inferior pubic ramus, and that's all that we need to know for the pelvis. Then next, we have the femur. This is the femur or the thigh bone, and then with regard to the femur, on the posteromedial aspect, we have the linea aspera right over here, and that's pretty much it in terms of the important bony landmarks with regard to the adductor brevis. The adductor brevis attaches from the inferior pubic ramus and the proximal portion of the linea aspera. And because it crosses both the pelvis and the femur, we know it's going to have actions in both of those areas. At the pelvis, its main action is going to be anteversion of the pelvis or anteriorly tilting the pelvis. And then it's also going to have some component of ipsilateral elevation, so elevation to the same side, and ipsilateral rotation, so rotation to the same side. And then at the femur, its primary actions are going to be adduction, so bringing the thigh toward the midline, and also flexion of the femur. And then one of its lesser actions, depending on the orientation of the femur, it's going to be responsible for both medial and lateral rotation, but that's pretty much it in terms of the actions of the adductor brevis muscle. The adductor brevis is innervated by the obturator nerve, and more specifically, it's going to be your L2 and L3 nerve roots. And the reason that's going to be very important is because if you have any type of damage or compression to those nerve roots, then the nerves are not going to be able to send the proper signal to the adductor brevis, and it's not going to be able to fire properly. And if it doesn't activate properly, that can limit blood flow and oxygen to that area. So what you would want to do is some ELDOA exercises for the nerves in that area. The reason the ELDOA exercises are going to be really, really great is because the whole purpose of an ELDOA is to create space within a joint. So if we create space within the joint, that can improve function of the nerves, and then the nerves are going to be able to send the proper signal to the adductor brevis to activate properly, and that can improve blood flow and oxygen to that area. Today I'm going to be taking you through some strengthening exercises for the adductor brevis muscle. I'm going to be taking you through 2 different variations, each of which you want to be in a sideline position. You want to go ahead and take your bottom arm, rest your head on it so that you're nice and comfortable. Then with the top leg, you're going to go ahead and go into flexion, external rotation, and abduction, and plant your foot firmly on the ground. Then the bottom leg, that's the working leg. If we want to target the superior fibers, what we're going to do is flex the femur to 30 degrees. We're going to maintain slight bend in the knee, and we want to start in a medially rotated position. Then, principle of action, we're going to do a combination of adduction and external rotation, and we want to prioritize the lateral rotation over the adduction, and that's for the superior fibers. Then, if we want to target the inferior fibers, what we want to do is flex to 45 degrees, maintain the knee flexion, and then for this one right over here, we're in a neutral position, and we want to prioritize the adduction over the lateral rotation, and that is for the inferior fibers. Those were the 2 strengthening exercises for the adductor brevis muscle. Today I'm going to be taking you through some myofascial stretching exercises for the adductor brevis muscle. I'm going to be taking you through 2 different variations, each of which you want to be in a quadruped position. So your 4-point, this first one's going to be for the superior fibers, and what we want to do is you want to get onto your elbows. Then we want to go into maximum abduction of the femurs by spreading the knees as much as possible, and maximum medial rotation by placing the ankles outside of the knees. You want to drive your ankles down toward the floor. Maximum retroversion of pelvis, flat lumbar spine, flat thoracic, your chin is tucked in, crown of the head away, eyes looking down between the thighs to put the dura mater under tension, and this is for the superior fibers. Then, if we want to target the inferior fibers, we're going to step up onto our hands, and then we want the feet in line with the ankles. We then want to drive the hips posteriorly by driving backwards, and everything else is exactly the same. But that is for the inferior fibers, and those were the 2 myofascial stretching exercises for the adductor brevis muscle. Today I'm going to be taking you through an ELDOA exercise for the adductor brevis muscle, and it's going to be the L2, L3 ELDOA. For the L2, L3, ELDOA, you want to start in a seated position. You're going to go ahead and straighten out your legs, then you want to go into abduction of the femurs of 45 degrees. You want to maintain maximum extension of the knees, pseudo-inversion of the ankles by pointing your toes toward your head and the soles of your feet in toward each other by going into inversion. You're then going to go into medial rotation of the femur by pointing the toes in toward the midline. You want to maintain retroversion of the pelvis, flat lumbar spine, flat thoracic spine, your chin is tucked in, crown of the head is pushing up, your eyes are looking down at the floor to put the dura mater under tension with the arms, maximum extension of elbows and wrists, maximum external rotation of the shoulders, then you're going to flex the shoulders to the level of the coronal plane so your biceps are in line with the ear. You're going up with the palms, up with the crown of the head, and you want to maintain all of these components for 60 seconds, and that is the L2, L3, ELDOA.